OPPoisoning. Well, OPPoisons are widely used insecticides, pesticides, and nerve agents that causes irreversible toxicity by irreversibly inhibiting acetylcholine, causing increased concentration of acetylcholine at synapse and neuromuscular junction. Well, OPPoisoning can be due to three reasons. It may be occupational, accidental, or suicidal. Occupational is mainly due to insecticidal spray contact. Then comes the suicidal, which is due to ingestion of insecticide or OPPoisons directly. And then comes the accidental, which includes both insecticidal spray and ingestion. Then comes the signs and symptoms. Signs and symptoms includes diarrhea, urination, meiosis, that is pupil contraction, bradycardia, bronchospasm, emesis, that is vomiting, lacrimation, lethargy, salivation, sweating, muscle cramps, tachycardia, weakness, twitching, fasciculations, confusion, seizures, respiratory depression, and it may also cause coma or death due to excessive respiratory depression. There are also signs and symptoms which are confusing but seen, like hypertension and hypotension, which just depends on the situation, and pulmonary edema and garlicky breath. Next comes the diagnosis. Diagnosis includes clinical and lab diagnosis part. While in clinical, we had discussed signs and symptoms along with pesticide exposure is seen. And in lab diagnosis case, RBC and plasma cholinesterase levels are checked, which are lower due to OPPoisons. And another test done is Atropine challenge test. And then comes the management part. In management part, firstly check the patient's ABCs, airway, breathing and circulation, and do the needful. Then comes as per principles, remove the soiled clothes of patient, wash soiled skin and eyes. Patient should be kept in prone position, clear mouth and throat, and provide open space and oxygen, fresh air should be there, and it must not be congested. Insert an airway or intubate if the things are available and required. Perform gastric lavage if required and if things are available. Next comes its antidote. Its antidote is atropine, which is given 2 mg intravenously every 10 to 15 minutes till full atropinization. Now, what are the signs of full atropinization? Signs of full atropinizations are first is dilatation of pupils, and next is tachycardia, wherein heartbeat almost reaches up to 140 beats per minute. Next comes the receptor reactivators like Pralidoxime and DEM. For seizures, give diazepam and provide IV fluids. Mainly given IV fluids over here are Rivalectate and normal saline NS, and provide ventilation. If there is any respiratory failure, provide also ventilator. Next comes the Carbamate poisoning, which is just similar to OPPoisoning, but it is just short time period thing and reversible thing, and it is not much harmful as OPPoisoning. Now let's compare them. OPPoisons and Carbamate poisoning. For inhibition, OPPoison is irreversibly inhibited, and Carbamate causes reversible inhibition. Pralidoxime is required in OPPoisoning, and it is not at all required in Carbamate poisoning. For as of the duration, OPPoisoning are long-lasting, and Carbamates are short-acting. Side effects of OPPoisons. Side effects of OPPoisons includes peripheral neuropathy, Parkinsonism, chronic fatigue, and memory loss. Along with that, there are also other adverse effects seen like local irritation, drowsiness, giddiness, blurred vision, diplopia, tachycardia, and hypotension. Even in case of high doses, it can cause neuromuscular blockade, which is this cause of peripheral neuropathy and Parkinsonism, and also memory loss. Now comes the mechanism of action. Mechanism of action of Pralidoxime includes wherein Pralidoxime enters the bloodstream, it reaches the synapse and it binds to free anionic site. This Pralidoxime oxime part binds with organophosphorus part and forms complex. This oxime part collects the phosphorus part and forms the next complex and releases this complex, which in turn reactivates the acetylcholine esterase enzyme, which causes destruction of acetylcholine, and as a result there is decrease in level of acetylcholine. Thank you for watching.